I am here with Michael Sirimaturos and Alex Varkey to talk about the postgraduate Year 2 Critical Care Pharmacy Residency Program at Houston Methodist Hospital. Why have you found it important for pharmacists to take a leadership role in critical care and to dedicate resources to training this next generation of critical care pharmacists?
I think obviously pharmacy, critical care leaders is an area that we definitely need a lot more of. There's a lot of residents that go into critical care. It's one of the largest of the subsections. And I think naturally the traits of a critical care pharmacist kind of bring a lot of similarities in terms of leadership skills that are needed and the types of candidates that we get. So I think there's kind of a natural fit there. Part of it is really about, the ability to think on your feet, to deal with tough situations. And I think definitely critical care pharmacists and residents are trained to do that. And some of it's a natural ability and some of it has to be a little bit cultivated. But those are skills that I think that naturally is something that we find in our residency candidates. And we really want to ensure that they then go on to do great things once they leave residency.
I think if you look at, all the different specialties within pharmacy, in critical care medicine specifically, pharmacists have stepped up as leaders at the highest levels, within that specialty. And so, there's been a precedence of pharmacists serving as president of, the Society of Critical Care Medicine. If you look at, all of our graduates, including Michael and all that they have done professionally beyond graduation, we certainly are poised to continue to contribute to that pedigree of leadership within critical care. But it's absolutely amazing to see what critical care pharmacists have done to advance the profession, to provide for innovative practices within critical care, and stepping up into major leadership roles within the discipline as well.
What strategies can be applied across residency programs to enable residents to complete projects and publish them?
So, I think for us, our experience with pharmacy residency candidates, they come from all over the country. They have varying levels of research experience and research interest. And so one of the things that we implemented several years ago is a pharmacy research committee. And that pharmacy research committee has helped our residency learners, our fellows, and others, essentially level set as far as their levels of experience within research methods. And also it allows us to select projects that both align with the organization's mission and our strategic direction, so that we know that we're going to allocate resources towards those specific projects so that they can be done within, the relatively short period of time that residency happens, within 12 to 24 months. And so those things have allowed us to see our residents succeed over time in, not only seeing their projects through to completion during the residency term, but also leading to publication and other contributions to the science. And so that's been an extraordinary feather in our cap and in our program to help our residents succeed over the course of time as it relates to pharmacy research.
Well, congratulations to you, Michael and Alex, and the rest of your team. Thanks so much for sharing about your tremendous program.
Thank you so much.
Thank you.